When it comes to a nasal evaluation, whether that's from breathing or sinus disease, it's a really common topic for our ear, nose, and throat offices. Just think about your last aggressive cold, that congestion, the extra secretions, and some of the pressure that come through the face. Imagine if those symptoms persisted for 12 weeks or longer. That's what we would diagnose as a chronic sinusitis case. And in those cases, we'll see evaluations and treatments that will progress through medicinal approaches, all the way up to imaging, CT scans of the sinuses, and in some cases, with obstructed sinuses, even surgical intervention. We will start with an evaluation of the medicines that are available or have been used for them in the past to decide on a good course of action for the first 1 to 2 months. When patients have gone through that initial evaluation and initial medical management, but not seen the improvement in nasal obstruction, facial pressure, or chronic sinus infections, at 12 weeks we start to take on a different mindset. We might want to look into the actual anatomy of the sinuses. I say that sinuses can be sort of like fingerprints. Everyone has a similar pattern with just slight variances in the anatomy itself. And that can be all the difference between sinuses that perform naturally and sinuses that become chronically obstructed and painful. And imaging studies and evaluation with sinus scopes in the office are the ways we look into those possible problems. In those patients, if we identify anatomic factors on a CT scan or in the office, they may be recommended for sinus surgery to alleviate those problems. And really, it could be thought of as unclogging the plumbing of the sinuses. That if in that narrow exit from the sinuses we have an obstruction, with minimally invasive techniques, we can optimize the performance and natural drainage of the sinuses by just slightly enlarging those doorways. I don't want to give the impression that every chronic sinus sufferer leads towards surgery. A lot of our patients end up with success in the first visit or two, and I think again it comes back to tailoring each individual treatment to each individual patient. If you or your family are struggling with any difficulties breathing or chronic sinus disease, please give us a call. We'd be happy to help.